Pets are our family members who can't express their pain through words. As pets age, the need for precise diagnosis of diseases becomes increasingly important. Veterinarians, as the guardians of our pets' health, also need more assistance. These changes create new challenges in diagnostics, requiring solutions that go beyond traditional capabilities. The evolution of medical science from evidence-based medicine to precision and personalized medicine perfectly aligns with G-Links' mission. Since its founding in 2016, G-Links has been dedicated to delivering precise diagnostic solutions, effectively bridging the communication gap between pets and veterinarians. Our business covers more than 20 countries and regions around the world, providing innovative testing services with 20,000
音了。
对啊，你开它了，让它停在来边。
好，then let's get started. Dear veterinary professionals and valued G-Links partners, welcome to G-Links Academy and welcome to today's G-Links Sup. 我们先跑一遍。And welcome to today's G-Links webinar, Mastering FIP, Confident Diagnosis to Successful Treatment. This online session, and we're so glad to have you with us today, whether you're joining us online or catching the replay later. Infectious peritonitis or FIP continues to be one of the most challenging diseases in the field of medicine, and today's session is designed to help you approach it with a greater confidence, from accurate diagnosis to successful treatment. And it is our great pleasure to welcome Dr. Alison Jukes, who's the Fellow of Australia and New Zealand College of Veterinary Scientists. She also serves as the mentor in the University of Sydney Distance Education Programs. With over 16 years of clinical experience, Dr. Jukes brings profound expertise and unique insights into the diagnosis and managing of FIP. And please kindly note that all the contents presented in this webinar is intended for academic and educational purpose only. It does not constitute any forms of diagnosis, treatment, or medication guidance. So without further ado, let's hand it over to Dr. Alison Jukes and leave the time to Dr. Jukes' professional presentation.
Good evening. My name's Alison Jukes. I'm a feline internal medicine specialist working at Cat Specialist Services in Brisbane, Australia. And this evening, we're going to have a talk about feline infectious peritonitis. And the goal of the talk today really is to improve understanding of this disease, also improve our understanding of different diagnostic tests that we can perform so that we can obtain a diagnosis of this disease, and then we shall have a look at different treatments available as well. So as a bit of an overview, in the first part of the talk, we'll discuss FIP, pathogenesis and pathophysiology. Then we'll talk about how we obtain a diagnosis, looking at our patient overall from signalment to laboratory testing and more specific testing for FIP and feline coronavirus. In our part 3 of the talk, we will go specifically through cases of cats with a diagnosis of feline infectious peritonitis, as well as some cases which looked like feline infectious peritonitis, but were actually other different disease processes. And then our last part of the talk, we will have a look at the updates on feline infectious peritonitis treatment, with a particular focus on some of the newer antivirals that are available to us. So, starting off with FIP pathogenesis and pathophysiology, and I'm quite passionate about understanding disease process and how different diseases occur and what they do to our patients. If we can understand the pathogenesis and the pathophysiology of disease really well, then it can help us understand why our cases present with the clinical signs and laboratory changes that they do, and it will make all of us better clinicians. So we'll start here. And so, as I'm sure we all know, when we're talking about feline infectious peritonitis, the causative agent of this disease is feline coronavirus. And feline coronavirus is an RNA virus. It is present in cats worldwide. And when we have a patient infected with feline coronavirus, it but if we have a patient in which they develop FIP, then this disease is uniformly fatal unless treated. When we're considering cats with FIP, the most commonly affected cats are pedigree cats and young cats less than 2 years of age. The disease itself is commonly described as a wet form versus a dry form. A wet form is where we see effusions, commonly pleural or abdominal effusion, sometimes pericardial or scrotal. And a dry form is when we have granuloma formation in various organs such as kidneys, lymph nodes, or the large intestine. We can also see neurologic versions of the disease and ophthalmic or uveitis as well. And when we're trying to obtain a diagnosis, it's really important to consider that it's not just a single test which is going to give us a diagnosis, but it is a collection of different aspects of the patient which will make us suspicious or lead us to that diagnosis. And so foundational, it's really important to have a good clinical history and physical examination of our patient. Often we'll then do some blood tests, perhaps some imaging and sampling of affected tissues. And then there are some coronavirus specific tests that we can do, including PCR, as well as immunostaining for virus particles via immunocytochemistry on fluids or cytology samples, or immunohistochemistry in tissue samples. So as a little bit of a review of feeling, had a full recovery, which is really nice. And the owner actually felt that he was healthier after treatment than he had been before treatment. And so he was a cat that I would be worried that maybe there was that battle between the coronavirus and his immune system in his body, and it took him eventually developed into FIP, but by getting rid of his coronavirus, we actually made him a really happy cat. And so in this case as well, even though we had no specific coronavirus tests which were positive, we had the patient as a whole ticked pretty much every box. That's the end. So thank you very much, and we're happy to answer some questions.
Thank you so much, Dr. Jukes, for such an insightful presentation.
我稍微和你就是演示一下，模拟一下。
Yeah.
OK， 到后面就是这样的一个。
Thank you so much.
直接一个小的切过去了。
对。
啊，
没关系，可以啊。
OK。
然后到时候就是 Alison 这个回来就是这样，并且。
OK。
好 ，ask a question.
Thank you so much, Dr. Jukes, for such an insightful presentation. And we have received some excellent questions from our audience. So let's move on to the Q&A session. And Dr. Jukes, let's get started with the first question from our viewers. So the first question is, how I might conduct a PCR test, and could you please tell us the specific application scenario when we're going to use the Jillink's FIP panel?
他真的能回答这个问题吗？
不能。
对啊。
这个就是让他，我们就跳过，我们不选这种问题。
对。
好。
因为这个老师那边到时候可以 share 他的 PPT 吗？因为他有时候
也可以
share 是吧？就是他可能对他的 PPT 来讲。
So the last question should be blah, 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 blah. Okay, thank you guys. Due to the time limitation, we can not just collect and finish the answer of all of the questions that you have. And I believe you have been learned a lot during this online session. For further questions you want to get the answer, please contact. After today's online session, please contact our regional sales manager or our distributor salespeople and feed your back. Just
准备好你这一段，你现在也临场发挥吗？
Tell them your question, and we will feed you back as soon as possible.
只有13分钟了，你赶快把这个准备好。
OK， 然后 Dr. Alison Jukes 这边都完事儿了，然后我们到最后一个了，是吧？这个 Q&A 环节之后还是我。Okay, thank you once again, Dr. Jukes, for sharing your valuable experience and expertises. We hope that this session has provided a critical insights and renewed the confidence in managing FIP cases in your clinics. To watch the reply or stay updated on the upcoming Jillink's webinars, please scan the QR code on the screen and follow us on Facebook or YouTube. Have a wonderful day, and we look forward to seeing you again for the next session.
OK。
就我的目光是有感觉在看稿子吗？
有一点点感觉在看稿子，不影响。然后到这里我就可以按那个 stream 了，对吧？
For your session. Okay.